Hi, it's Dr. Angie Settle with Your Health Done Right, and I have Rhonda Francis. She's the clinical manager at West Virginia Health Right. She's here with me today. We're going to talk about the annual We Care West Virginia Day, and it is October the 19th, 2024. And we've had Rhonda on before, and we always have a good time because she has been at Health Right almost as long as me, so we always have a lot to talk about. But this is a big deal because we have had the annual, we call it the RAM event, Remote Area Medical. Our good friends, Remote Area Medical, that have come in every year since 2016, and we've done a big event. It was first we did it in Elkview, then we moved it to the Bible Center School, and we've done it there every year. But this year we have, the expanded facility on the East End, and we have the size and capacity to do it there at the clinic on the East End. And so this is the first year that we're going to be doing the event on our own. So we want to talk about that today, again, October the 19th, 2024 at West Virginia Health Right. And again, it's going to be an annual event. Welcome, Rhonda.
Thanks. And it is exciting.
It is exciting.
We've made a few changes this year. The
Absolutely.
time is one of them.
Yeah.
So it's 8 to 5. They don't have to come at 3 a.m. and get a ticket. So.
Well, with Remote Area Medical, they do great work all over the United States. They even do, stuff internationally. They have hard and set rules that they've established, and we work with them. Again, our portion was to bring in the volunteers and do that part and do everything locally, and they would bring in the equipment. But there was an early start. It was like 4 a.m., and we know how hard that is for people to come out that early, even though we know healthcare is so important. So now we've been able to adjust it. We picked the name We Care West Virginia Day, same concept, all local providers and volunteers. We call it West Virginians helping fellow West Virginians, and it's at the clinic. So it'll be in the clinic setting, but again, the time is so much friendlier. It's 8 to 5, so we don't have to have people out getting tickets at 3 a.m., 4 a.m.
Yeah, it's very exciting.
Yes.
Same services, so we'll have medical, dental, and vision. We'll also have flu and COVID vaccines and HIV and Hep C testing as well.
Right. And then the pharmacy, of course, is there.
Yeah, so we have our pharmacy on site.
So that helps because before, I know we had the totes.
Yep.
Volunteer Franny, who's been on the show, we'd take her little totes out to the Bible Center, and we would try to guess what the doctors might need, sample-wise and all that through our pharmacy with our pharmacist on site. But now we'll actually have the support of the pharmacy and all the clinical facility, the exam rooms, the eye room, the dental clinic, and all that on site. So that part should be easier because I know RAM does a great job of trying to create a clinic on site, and we will actually be at our clinic.
Right.
And we do a lot of this work. We've talked about it over and over again at Health Right every day, is to help people have access to health care. And this is a specific day to just do that, where we don't ask questions about insurance, because we know there are people out there that have insurance, but they have copays that are in the way, or they may not go to the dentist or whatever. And so this gives them a day, no questions asked, to come in and get that care. And we know people that use this, for their cleanings or, their exams or to get glasses. Now that's one adjustment. We don't have an eyeglass making van on site, but we do have the means to get glasses. So we'll be ordering glasses that day and then either mailing those out or having people pick them up if it's the preferred method. But if people travel, we'll be happy to mail those out. But we will be able to get glasses. And we have great volunteers. Dr. Chris Stansberry, who's a local optometrist at West Virginia Eye Physicians, I think is the name of it. And he does volunteer work for us. He'll be heading up our visual clinic. And then we have Dr. Tom Takubo, local pulmonologist, who's going to head up the medical department. And then Dr. Michael Tupta, wonderful dentist, and he's also a board member who held up the dental department. So we try to have local volunteer leads that have proven history of success in the community, and volunteers that we know their hearts are in the right place that'll be helping us. And of course, Miss Rhonda will be there cracking the whip, making sure that everybody's where they're supposed to be to get it all done, right?
We will be there. It will be a first come, first serve way, so just be patient. But We'll do our best. Something else, I mean, there's what we forgot to mention, there is women's health since we have it on
Right.
site. And we also have family planning.
Family
So if
planning's
you're needing
important.
family planning, like a Nexplanon inserted, you
Right.
can actually get it done that same day.
And when we refer to family planning, we're talking about all the things that you can access for contraception, like oral birth control, injectable birth control, the little rods that you put in your arm, the Nexplanon, IUDs, that kind of thing. So we want to make sure people have access to that as well, to prevent any unplanned pregnancy. So they'll have access to that day as well.
Yeah.
Absolutely. And then we talked about vaccines and all the other things. I think it'll be a lot of what we already do, but an expansion on that so that it'll be more comprehensive. You agree?
Yeah.
Yeah.
Yeah. So vision, we'll have the eye exams, and then we'll also order the eyeglasses.
Right.
And we still need volunteers.
Yes, we do need volunteers. I don't know the site that they go to, Rhonda. They can just call the clinic, or they can just call me directly.
They can go to our website, which is www.westvirginiahealthrate.org.
There you go.
And it has all our information on there,
Yes.
so to volunteer.
Yeah, and I'm sure they're going to.
Also, if you ever want to volunteer at the clinic, we're always looking for volunteers there as well.
Absolutely. I'm sure they're going to list it on the screen. I just have too many numbers, and I'm pushing 53, so I can't remember all the numbers all the time. But if you go to our website, you can do that, or you're welcome to call the clinic at 414-5930 and ask to talk to somebody about the We Care West Virginia Day, and volunteers can do so as well. We're always welcoming, eye doctors, physicians, nurse practitioners, dentists, dental hygienists, anybody, lay people, nurses. We'll have people there that will be triaging, taking blood pressure and stuff, but then just getting people from A to Z in a big day with that many people coming in, even parking lot attendants and things like that, just to be organized for that day. We'll need all of those helpers. But again, you can't make an appointment for it. You can't call and get it, your name on a list. It's a first come, first serve. And again, that's it's going to be an annual event. We may go to 2 days. RAM was a 2-day event. We want to try 1 day and then go from there, but then it will be an annual event. So, and again, the need tells us, if people show up and we see the need, then that tells us, hey, we need more than 1 day, that kind of thing. But again, for now, it's October 19th, 2024. But Rhonda will be there. I'll be there, of course, and we will be doing our thing, trying to help people in need. And that is what pushes us forward, and that's the whole goal of this event.
Yeah.
But again, it's still a lot in keeping with Remote Area Medical Center if you've been to those events, but just a little bit of a twist to it and try to be a little more friendlier to people that are coming out. And of course, we do have people that drive. I had somebody say yesterday, I think we're from Martinsburg or somewhere, talking about, hey, do we have anything like that up here? And it's like a 4-hour drive. I get it. We, with the budget that we have at Health Right, we do see over close to 45,000 people a year, and we treat from 34 South Central counties. But we'll see anybody from West Virginia in need that gets there. But unfortunately, we don't have the capacity to have multiple clinics everywhere. There are other free clinics in the state that you can look up, but this specific clinic is going to be here locally because we do depend on our local volunteers. And unfortunately, we can't get them in a bus and bus them 4 hours away. But if you can make your way there, we'll have it there in the parking lot. It will be safe. I'd hate to say, if anybody would drive, but if somebody would want to drive and be there early on the lot, it'll be right there on our lot. We'll make sure we have security there, and it'll be safe and everything. But it would be worth your time to come and get this care because we know how hard it is. There's so much access problem in our state, especially with dental, vision care, etc. People don't understand how life-changing it can be to get that dental care or to have a pair of glasses. We've had people come that had the same pair of glasses 5 or 6 years, or people that really needed glasses that never had them. And it can be life-changing. I'll never forget that I think it was about 3 years ago, there was a whole family, and there was like 8 of them, and I think 7 of them needed glasses, and they all got glasses that day. So it was a great event. It was a great event. But just in looking retrospectively at this event, Rhonda, what sticks out to you? What do you get personally from these events? What makes you get so excited about them?
These events is, I mean, I get excited because we get out and we get to just, we get to serve patients. You don't have to worry about anything else. You don't have to worry about, any ID. We don't have to worry about insurance. We're just there to do our job.
Yeah.
And whatever they need, we'll do our best to take care of it. So, they can get medical there, like I said, and then, dental, we'll be doing extractions, cleanings, and fillings. Now, we've had a couple of calls about root canals. Unfortunately, we don't do root canals.
No root canals that day.
But we do, they'll do an exam on you and an x-ray and decide what you need that day. And, in the past, we've seen full extractions of the mouth, and then we actually work with that patient after that to get dentures.
Well, even like a Panorex, I'm not dental, but Panorex is the x-ray that goes all around your head and gets the full dental. Those are so expensive, and that's equipment that we have there that people, can get along with their exam and everything. And then we'll have, some volunteer specialists. We don't know all of them yet, but you can check with us that day. We typically get volunteers from different specialties that'll come in, and hopefully we'll have a list of those, and then we'll be able to know. I mean, just for example, you might get cardiologist or urologist, you're just not sure. That a lot of times people can't access that when you're typically going through the system, and you get that question about your insurance coverage, or it's $150 up front or whatever that a lot of times you have to deal with a private office. We won't be dealing with any of that day, which is a great thing. So we won't be asking for any money or anything like that day. We just want people to come as they are and come get the care that they need.
Absolutely. And it's a good experience for students.
Absolutely. I agree.
To get their community service hours. And we have a lot of students there. We have a partnership with WVU and Marshall.
Right.
The School of Osteopath have students coming, and we also have University of Charleston will have their pharmacy students there.
Yeah. So that's a good idea. If there's any students out there that need experience or anything like that, to reach out and come, because again, this is, where the rubber meets the road. Yes. I think it's so important for all medical professionals to have that experience, to see what it is to be a person in need. It's so much more than, handing somebody a prescription, sending them out the door and, thinking you did your job. We have to look at, A, can they afford that medication? B, do they have the transportation to go get the medication? All of these things. And sometimes people, we have pride. It's hard to admit those things.
Yeah.
So it's our job as professionals to be asking those questions and to think outside the box. And you can't always have the advantage of referring somebody, to a social worker and just having them deal with it. We have to be thinking, it's so much more than just seeing them in the room and handing them something and walking out. You got to think of the whole person for sure. And so important to get those routine tests like hepatitis and HIV tests and all those things that are pretty much standard now, all the preventative care things. So tell me what else what we plan on. I know we talked about some testing. Will we be doing flu vaccines?
Flu vaccines. We'll have COVID vaccines as well.
Perfect.
University of Charleston, I've got them, the pharmacy students set up with Carrie.
Narcan training, we'll be doing that again.
We will do that as well. So we'll have Narcan there.
That's something that we offer at HealthRate, every day that we're open. But that's a great thing to know. Anybody that doesn't have it or is not, knowledgeable about how to do that, is so important in today's world that you have the means to do that. That's great. We'll have pharmacists doing that. Yeah.
Yep.
And of course, we'll have information about all of our services and connection. We don't ever want to be a red light, stop sign. We always want to be a green light.
Right.
And so if we don't have the answers, we always want to connect you with somebody who does, which is so important. And even for those people, maybe for whatever reason, if they've been held back or they're anxious about coming for help, this is a great opportunity to be there, with other people. Just a unified day to come out and get experience. And if there's anybody that needs follow-up, of course, we're not going to leave them. Like I said, they'll come back to West Virginia HealthRate to get the continued care and follow-up that they need, which will be great. Yeah, so.
Yeah. In the past, we have found several things. Dr. Takubo has found lung cancer on a patient before. And then we've had oral cancer screenings, and we've treated them on patients that didn't even know that they had it.
I know Dr. Stansbury found eye cancer.
It's really a good event.
Yeah, so it's more than just, oh, okay, I'm going to get my teeth cleaned, or oh, I'm going to get a visual exam. It's more than that, because like you said, we've actually saved lives. These were events where people did not have access, and they came out thinking they were just going to get a pair of glasses, and they actually diagnosed them, with an early onset eye cancer that was treated. So, and what's important too is every provider that's there is a volunteer. So they're there because they want to be there. They're there because they love West Virginia, and they love the people, and they want to help their fellow man. So it's just an overall good event. I'll tell you, as providers, it's always good to just feel that warm feeling and remind yourself why you got in the profession in the beginning. What brought you there. It's so fun to just do that, not worrying about bills and this and that and prior authorizations and all these other things. You're just there to take care of people. And, go in the pharmacy. I'm going to age myself until the blue light specials like at Kmart, and you'd see what's in there, and you just grab, what you needed for patients, and of course through the pharmacist, but you know what I'm saying. And just give people what they need, and that's what's so real about it.
Right.
That for providers, if anybody's interested, again, you can call 414-5930 and go to our website, www.wvhealthrate.org, to get more information on the event. But we welcome, all volunteers, because again, that's just a good reminder of, why you do what you do in a profession, and it's a good day to do that. And when we were going back and forth with the names, we came up with the We Care West Virginia, because I think that captures, in the Mountain State, what HealthRate does, what our providers do, what our volunteers do. It's all about, showing that love for fellow West Virginians, and I think everybody will go. We'll have T-shirts, we love the thing, everything about West Virginia, except during the season of basketball. It's all about Kentucky from Rhonda. She's a Kentucky girl. We will forgive her for that.
I do bleed blue during basketball season.
We forgive her for that. There's a little navy and gold in there, though, anyway. But absolutely. So some of the medications that we'll have that day, you want to talk about that a little bit?
So dental, we'll have our protocol that we usually have. If they need an antibiotic, we'll already have like amoxicillin and clindamycin and Zithromax. And of course, we don't do any narcotics at our clinic, but we do have, ibuprofen and Tylenol.
Right.
If they need something for pain, if they've had an extraction. And then we also, if a doctor needs something, now that we have the pharmacy, they pretty much can come in and look. So if they need something, an ACE inhibitor, then we're going to have lisinopril right there to get the patient started on it. Or, if they need something for diabetes, then we have a whole section there. If they need insulin, we have it as well. So, we have the Humulins, and then we have Lantus.
We'll have like EKG machine and that kind of thing. Of course, we're not going to be handling any life-threatening emergencies. Those, we've had to send people to the ER before. So that would be the same process. But anything like that, we'll handle there. If there's things testing that they need to have done or whatever, we'll be working to send them out for that. Women that need a mammogram, we'll make sure you have access to that. We don't have that in-house, but we'll do, your breast exam, your female exam, pap smear, and then, send you out with an order to make sure they get that done. So I've had people ask me before if we're going to have mobile mammography there, but not on site that day, but we will be able to send people for that locally. Absolutely. What's some of your most memorable times over the years when we do these clinics? I know every day we do this at HealthRate, but just looking at...
I think since we started doing these clinics, we were able to see things that were needed, from the very beginning. For instance, in 2016, when we had the flood and we set that up and we had to actually go mobily, that's when
crazy.
You made the decision to, to add the mobile dental unit,
Absolutely.
which, goes out to 5 rural counties now, and it's extremely important. There's a lot of people that just can't access dental care. That was something that we didn't notice before until, we had that crisis situation, and then all of a sudden it was like, oh, this is needed.
Yeah, I'll never forget that. So, we'll just kind of reminisce a little bit. When we had the historic flooding in 2016, most locally it was in Clendenin area, so that's the first place we were called to go there. We didn't have any kind of mobile units, didn't have mobile medical or anything. So the biggest thing we had was my Suburban, because I have so many kids. I got a big Suburban. So we took that to Clendenin and popped the trunk and basically had a tarp and a tent because it was still raining and everything. And we ended up treating people there, medications. It was an experience. It was very humbling and such a reminder for us. You know, it was great to have the facility on the East End and offer medical and the pharmacy, and we had some dental on site, but it's another thing out in the field when people, you know, they can't access it.
Right.
So that's really what kind of spawned in us that desire, because then we went other counties. I can remember all the counties we went to at the time, but you remember.
You're in Clay. We even went to Greenbrier County.
Yeah, we went to Greenbrier County,
wherever we
somewhere
were
else, too.
needed. But, you know, by that time, too, we were renting vans and going different places.
Yeah.
But, yeah.
Because a lot of it at the time, too, was even like just tetanus vaccines and all of that kind of thing. But learning what people needed that day, I know in Clendenin, it would be like, okay, well, I don't have that with me, but if you can meet me back here tomorrow at this time, I'll bring that prescription. You know, we'll get to that field and we'll bring it back to you. Because, you know, when you're in a flood situation, people are just escaping with their life. They're not thinking about, you know, grabbing this or grabbing that. And then it was like, okay, dental needs, vision needs, et cetera, which was kind of how the RAM event was born and how the whole thing started. And then once we started, you know, doing it, we could say, wow, this is a big need. You know, this is really a huge need out there. And that's kind of how the whole thing started. So I'm excited about putting our own spin on it, putting the health right spin on it, seeing how the hours go, see if that's friendly for people, because I've had people before say, oh, that sounds great, but, you know, I can't get there at 4 a.m. because if you're not familiar, they would do a ticketing system where we handed out tickets and the lot would open at midnight, and then tickets was at 3 a.m. or 4 a.m.
Tickets are 3
and then the doors would open at 6. And that's hard on patients, especially if they're elderly, if they have any kind of disability. It's kind of hard on volunteers, too, to get up that early and be out there. But we're hoping the times with this event work out. And, you know, whatever we don't like, we'll learn, and then we can change it. You know, it's going to be an annual event. We can always add days, change times, do whatever we need to do. So I know that's a little bit nerve-wracking for Rhonda and I. We're a little bit nervous, and any Virgos here. We like to plan and do all that.
We have a little bit of OCD.
We do, just a little bit.
I like
just
it organized.
Yeah, so it's exciting, but a little nerve-wracking as well. But generally, you know, hey, if our heart's in the right place, it generally works out and everything's good. But we're still looking for volunteers. Again, you know, go to the site, www.wvhealthrate.org. Or if you can't remember that, call 304-414-5930 and just ask to talk to somebody. Or you can ask for Rhonda or Angie to talk about the We Care West Virginia Day. I'm trying to think what else we need to cover so that people understand. I think it's important to understand that they don't, again, no insurance. You don't have to prove that you don't have insurance. You don't have to prove that you do have insurance. You don't have to prove to us that you're financially in need. You don't have to come and tell a story of why you need help. It's just a day to come, you know, be patient, get in line, and we'll help you. And there's no questions asked on that. You don't have to explain to us why. You know, things happen. I was thinking about a lady that had called me the other day, and she, you know, her husband worked, and there was some situation with the car and a car repair, and actually some unexpected expense. And she said she was really embarrassed, but she needed help with food assistance with like the food pantry over on the west side. And that just, you know, kind of was a reminder to me of how things can happen in life. You know, unexpected medical expenses, car expenses, things that happen, and things you're not ready for. And the expense of, you know, even with insurance, you know, like with glasses and co-pays and dental work and all of that, it can be crippling. Yeah.
And with this economy the way it is, we're seeing even more just on a daily basis coming into our clinic and needing help. Which is why our numbers are growing on a daily basis.
Yes, so. More and more people. Yeah, and of course, you know, people that can't wait and they need help, they can always come into Health Right or call us, because this is care that we do every day. But this event is kind of like Health Right on steroids, where we mobilize everybody and plan on having, you know, huge numbers of people coming out. We don't want you to be afraid of the numbers, though, and think, oh, there'll be too many people, you know, I won't go. We've had issues in the past where we have, you know, a lot of people come and then there's nobody there for the doctors or dentists to see, and people could probably just like walk right in. So we'll have a little bit of flexibility with that. to kind of gauge, you know, how many
Yeah.
that we'll see. And the way we'll figure out how many we can see is by practice, of course, but knowing how many volunteers that we're going to have. So anybody that's interested in volunteering, it's so important that you let us know in advance.
Yeah.
Because we actually gauge the number of patients at the door that we accept based on how many volunteers from each specialty that we get, as in dental, vision, medical, etc. And then we'll know closer to the time, like the different volunteer specialties that we'll have. I'm sure that a lot of the good old Health Right volunteers will show up and help us, and you know, we'll be able to see a lot of people. But great day just to come in and get those much needed health exams. A lot of people don't take time to do preventative care. We're so busy, you know, in day to day. People may wait till they're sick or something goes wrong. Well, here's a great day to come in. Maybe you get a good, just a physical, you know, get your blood pressure checked out, get those vaccines you need, get tested, you know, get an oral exam, get your teeth checked out, you know, vision, that kind of thing. So it's so important. There's a lot of people probably haven't had an eye exam in years. If you're like me, I'm nearsighted, and I didn't realize how poor my sight was until I was at the movies with my husband one day and couldn't read some of the letters on the ads, and he was like, "You need glasses." And here I am, you know, a professional, and that's kind of how I figured it out. So a lot of times it just kind of creeps up on you.
Yeah.
So it's important, and plus we talked about, you know, checking for visual cancers and things like that. So if you've not had it done, even if you think you're okay, you really need to think about, you know, getting those eye exams and getting those oral health exams to pick up things like cancer, all those kind of screenings. What do you think, Miss Rhonda?
No, I agree. And especially, I mean, we've seen a lot more since COVID. People, you know, kind of delayed their screenings during that time and then are coming in. And unfortunately, now we're seeing more patients that are getting diagnosed with a type of cancer because they delayed their screening during the pandemic.
True, because everybody was told to, you know, stay home, don't do this. Everybody was afraid to go out. And now it catches up with you. I think that's something that we're seeing a lot in the healthcare arena. But now it's time to get back on track, get those vaccinations, get those exams. Ladies, get your female exams, your breast exams, all those kind of things, because of course prevention's always better, you know, than trying to do a cure. It's important to keep an eye on all those things for sure.
Absolutely.
Absolutely. So we'll be doing this. We'll be doing this thing annually. We're committed to it, and Health Right and all our volunteers will be doing this every year, and you guys keep an eye out for it. And we hope that you will be able to come in and get all the care that you need. And we never want any kind of issues with money, or my favorite saying is we don't want ever to have money stand in the way of access to care, for sure, at West Virginia Health Right. Thank you, Rhonda, for coming in. You always offer so much. You're my good old visitor to come in every time, and we can always talk about Health Right for hours on end.
Yeah.
Thank you, Rhonda. I appreciate you coming in.
Thank you for having me.
Yep, and we're excited. We want to see everybody out. Please, please, please make sure you come out and get care.